To begin with, let's start with our top story. Experts push for village committees to protect girls and young women. A growing call is emerging for government to establish grassroots support systems to tackle the rising cases of sexual and reproductive rights violation, especially among young girls. During a training in Kawempe Division, experts and community advocates urged authorities to introduce independent village-level committees and peer educators to address abuse and misinformation and also silence surrounding the sexual and reproductive health and rights. The training, organized by the Paradigm for Social Justice and Development, highlighted the gaps many girls face in accessing help, with facilitators warning the lack of awareness and support system is leaving young people vulnerable and forced relationships, early pregnancies, and abuse. Facilitator Chris Charles Oyua emphasized that many girls do not speak out because they lack trusted people to turn to, and proposed a system similar to village health teams where trained peer educators can offer guidance and support at community level. Participants also raised concern over stigma and fear, which continue to silence victims and prevent them from seeking help, while calling for stronger awareness campaigns, especially around HIV prevention and informed decision making. Organizers say empowering girls with knowledge of their rights alongside strong parental guidance and community involvement is key to addressing this crisis. The push for village health committees reflects a wider belief that real solutions must start with communities where trust, accessibility, and early intervention can make the biggest difference. Moving on to our next story, Ugandan teens turn to Google as family silence warns health information gap. A new study by Mbarara University of Science and Technology has revealed a growing concern that young teenagers are increasingly turning to the internet and peers for sensitive information due to silence that happens in their homes. The research shows that adolescents aged 10 to 14 are navigating critical sexual and reproductive health issues without proper guidance from parents, creating what experts call as communication vacuum. This was conducted in Nachivule refugee settlement and Budibidi refugee settlement. The study found that when open communication exists between caregivers and teenagers, the impact is powerful and young people far less likely to engage in risky behaviors. Lead researcher Viola Nyakato warned that many adolescents are relying on unreliable resources, exposing them to misinformation that could affect their health and also the future generations. Experts are now calling for shifting from relying on only school-based programs to empowering parents to lead conversations at home, despite culture taboos that often make decisions difficult. The findings highlight a critical message, and breaking the silence within families could be one of the most effective ways to protect young people and guide them towards a safer and more informed choices. Moving on to our next story, Mityana General Hospital buckles pressure as patients' number surge beyond the capacity. Mityana General Hospital is facing an unpredictable strain as patient number soared to near 800,000 annually, for exceeding its original design capacity of just 84,000 patients per year. Hospital administrators have revealed. The overwhelming demand has effectively transformed the facility into an official referral center, serving not only Mityana district but at least 5 neighboring districts across the Wamala sub-region. Medical Superintendent Joseph Konyogo says that the surge in the patient numbers has stretched the hospital already with limited resources to the brink. The number of patients we receive keep increasing day by day, but staffing levels have not expanded accordingly, he said. Currently operating with only 40% of the received workforce. The hospital is grappling with several staff shortages, leaving health workers overwhelmed and impacting both the speed and quality of service delivery. Despite continued government supply of essential medicines, the sheer volume of patients has led to rapid depletion of drug stocks, further complicating the service provision. Dr. Chikonyogo explained, "We do not receive drugs, but the volume of patients we handle leads to faster depletion than planned. Financial constraints are also adding to the crisis, whereby the hospital receives approximately 157 million shillings per quarter, a figure administrators say is no longer sufficient to sustain operations at the current scale." And in the response, the hospital management has introduced internal reforms aimed at improving the efficiency and accountability, and among them is a rollout of electronic drug dispensing system designed to track medication use and eliminate manual handling by the individual staff. Health officials say that strengthening the services and calling for urgent government intervention, including increased funding, expansion of infrastructure, recruitment of additional health workers, and possible elevation of the hospital to the referral status. And also say that the strengthening of the facility capacity would not only ease the pressure on the overstretched staff, but also significantly improve access to quality health care for thousands of people across the wider region. Moving on to our next story. Minister Acheng calls for dedication among health workers. Uganda Minister of Health Jane Ruth Acheng has called on health workers to remain dedicated to service, emphasizing the importance of commitment in strengthening the community's healthcare system. This was during an event that happened where ministry staff and stakeholders gathered to appreciate her leadership, particularly during a major public health challenge such as COVID-19 pandemic and the pandemics that have come in later. Dr. Acheng acknowledged the contributions to both formal health workers and volunteers, assuring them that their efforts are recognized and the opportunities will be created in the future. She urged them to continue serving with diligency, noting that the strength of Uganda's health system largely depends on the people that are delivering the care. The event also attracted religious leaders and also the health professionals who offered prayers and support, highlighting the importance of unity, resilience, and leadership in addressing the national health challenges. And she also added that she would be giving out ambulances that will be helping health workers and in different areas around Uganda that will help in the emergencies that they normally receive. Let's hear what happened there.
Also to impart knowledge to the village health teams and to supervise. Ensure that they are doing the right thing. That's why I say work together. Of course, the VHTs will not get allowances per month like you do. For them, they get allowances per activity. Work. You have been empowered with transport to move through the communities door to door. We also know that a parish may have more than 10, 15 villages. It is not you to move there. The village health teams are supposed to support you. But try your best to move and also to impart knowledge to the village health teams and to supervise. Ensure that they are doing the right thing. That's why I say work together. Of course, the VHTs will not get allowances per month like you do. For them, they get allowances per activity work. You have been
that is the Minister of Health, Dr. Ruth Acheng. Moving on to our next story, Uganda government pledges to eliminate malaria as Uganda marks the World Malaria Day. Uganda has reaffirmed its commitment to eliminating malaria and reducing malaria-related cases and deaths among the country as it marked the World Malaria Day in 2026, and this happened in Uganda district. And the Minister of Health, Dr. Ruth Jane Acheng, reiterated government efforts to strengthen prevention and improve community health service. Her message was delivered by Dr. and Director General of Health Services, Dr. Charles Olalo, during the celebrations held at Bulamali Sub-County Headquarters. A key of the event was passing out of the 105 community health extension workers called the CHEW, who completed 6 months of training to support health service delivery at community level. Dr. Acheng emphasized the importance of the CHEWs in fighting malaria, noting that many cases can be managed at the community level with better awareness and early action. The World Health Organization also pledged continued support to Uganda's malaria elimination efforts, saying a malaria-free future is achievable with strong partnerships. Officials say that the CHEWs will help improve access to the healthcare in rural areas where malaria remains common, and Uganda continues to promote the use of mosquito nets, indoor spraying, and also early treatment to reduce the infections. This event was held under the theme, "We are driven to end malaria. Now we can, now we must," highlighting the renewed urgency in the fight against the malaria disease. Let's hear what happened there.
In the world. So I start what? If you look in terms of deaths, we are number what? Number 8. So it means actually malaria remains a very big what? Big problem. If you go to economics and look at aspect of what we got in the what? In the world. So I start what? Highest. If you look in terms of deaths, we are number what? Number 8. So it means actually malaria remains a very big what? Big problem.
Okay, that's what happened as Uganda was embarking on the World Malaria Day that happened in Uganda district. And moving on to our next story, a World Health Organization has approved the first malaria treatment for newborns and also the rapid tests to help check for malaria. The World Health Organization has approved the first ever malaria treatment designed especially for newborns and infants weighing 2 to 5 kilograms, marking a major milestone and in the child health. The drug, a special formulation of the altimeter lumetriptyline, will help close a long-standing gap where babies were previously treated with medicines meant for older children, often causing dosing errors and also the safety risks. The approval will now allow countries to safely procure and distribute the treatment for millions of newborns in the malaria-prone regions. WHO says this breakthrough could improve care for about 30 million babies born each year in malaria academic or endemic countries. Alongside this, the World Health Organization has introduced new rapid diagnostic tests that detect malaria more accurately after some parasite strains stopped showing up on older tests. The new tests target a different parasite protein, helping reduce the missed cases and also improving early treatment. Health experts say these innovations come at the critical stage as malaria cases remain high globally, even though progress in vaccines and prevention tools are made across countries and as they continue. So those are our news updates for today. We are going to go into our next session where we shall have an expert insight about a disease that we normally know and we don't often talk about. But before we head there, let's take a short break and then we come back with more.